So to begin, I will be talking about the sexually transmitted disease gonorrhea. This disease can be transmitted through oral intercourse, vaginal intercourse, or anal intercourse. There are many symptoms that will happen on your mouth, your vagina, and anus, depending on what type of sexual intercourse you have had, which will give you a clue on if you've transmitted gonorrhea. In the vagina and penis, you will feel pain in the genital area, pain during urination, discolored discharge, pain during sex, and women may even bleed between periods. In the anus, there may be itching, discharge, bleeding, and pain while using the restroom. Both genders can transmit gonorrhea by having any three of these intercourses. But studies do show that men do receive gonorrhea more than women do, and women do not receive as many symptoms as men. I found an article and I had read it. It's called High Prevalence of Rectal Gonorrhea Among Men Reporting Contact with Men with Gonorrhea, which was researched by 8 different researchers. This study was conducted at a center called the Melbourne Sexual Health Center in Melbourne. Sorry, I don't know what which is in Australia. The background of the study was to determine the prevalence of gonorrhea and the factors associated with rectal gonorrhea among men having sexual contact with men who have also transmitted the disease. All men who had walked into the Melbourne Sexual Health Center who had sexual contact with men who had gonorrhea were brought into the study between March 2011 to December 2013. All of these men had transmitted this disease by anal intercourse, and during the course of the study, men who had come in contact with men, the percentage of this was 26.4% compared to 3.9%. So this disease has risen a lot over the years. Among these men, some said they had used condoms, some reported no condoms during sex, so it just kind of depends on what they were doing. The results of this were brought into the medical center and had us come to conclusion that the high proportion of these cases of gonorrhea among contacts during the study supports the epidemiological treatment of MSM, which is men having sex with men. Studies show that if men have sex with men or who have multiple partners, have a higher chance of contacting the disease or multiple diseases. If you don't get gonorrhea treated in time, in women, the formation of scar tissue can happen, which can block the fallopian tubes. It can affect pregnancy, cause infertility, and long-term pelvic pain. In men, this disease can cause infertility, pain, and also can spread to the blood, which can cause DGI, which is characterized by dermatitis, arthritis, and tenosynovitis. To not really receive this disease, you can use the method abstinence, or you can get tested before having a sexual partner to make sure you guys don't have the disease, or condoms can help prevent it, but it won't guarantee that you won't catch the disease. Yeah.
So what to do if you have these symptoms? You want to seek treatment, because otherwise the effects of the untreated gonorrhea in a male will be inflammation of the reproductive system, which would include prostatitis, seminal vesiculations, and epididymitis. And then, penile pain would be caused by urethritis, which can then inflame the bladder, causing cystitis. And then, of course, the disease would spread to other organs, including the testes, which would cause scarring, which would then lead to sterility. Next slide. Oh. So an untreated female would present with the urinary system inflammation, which again would be urethritis, causing the burning and the frequent urination, inflammation of the reproductive system, which would produce discharge due to cervical inflammation, and further inflammation, it would spread and cause swelling of the uterine tissues and of the fallopian tubes, which would result in pelvic inflammatory disease. And because of that, scarring develops, which can lead to ectopic pregnancy and sterility. So for the treatment of gonorrhea, we have both oral and injectable antibiotics, which historically penicillin or tetracycline for those allergic to penicillin was in use. More recently, we use erythromycin, ciprofloxacin, ciprofloxacin, and ofloxacin. And as well, there is ceftriaxone and cefotaximine, which are also injectable antibiotics. So due to the now superbug nature of the drug resistance of gonorrhea, alternative treatments have been sought. So here I have a chart comparing the efficacies of both injectable and oral drugs. And among the injectables, ceftriaxone is the best efficacy. The gentamicin comes in second, but since it has limited usage, there's little known about its resistance. So the next best antibiotic treatment is cefotaximine. And for the oral antibiotics, the zithromycin is coming in as number one, but the ofloxacin and ciprofloxacin also have high efficacy, but are only recommended if azithromycin has not resulted in effectively treating the gonorrhea bacterium.
So for condom safety, as Miranda said earlier, condoms aren't a guarantee that you won't get the disease, but they do help prevent it. The first tip that I found in my article, which was called "Young People in the United States Are Often Misinformed About the Proper Use of Condoms," which basically just gave a bunch of different kind of statistics of different cultures and different percentages of men and women who were misinformed about how to actually use condoms. The first tip that I saw was making sure that any lubricant being used doesn't it doesn't affect the latex in the condoms and won't cause a reaction. There was a health survey that was conducted in this study, and with the response saying, when putting on a condom, it's important to have it fit tightly, leaving no space at the tip so that it doesn't rip as easily, since some condoms are thinner than others. Another one is to make sure you have condoms accessible to you, close by, to check the expiration on them. And then a few interesting facts that I saw from the textbook about gonorrhea was that you can't get the disease from kissing, sharing drinks or food, holding, hugging hands, all that kind of stuff. Another one I saw was that gonorrhea is actually the oldest of the sexual diseases. It's been around for about 4,000 years. The Greek physicians believed that gonorrhea resulted from, quote, excessive indulgence in the pleasures of Venus, which is the goddess of love, hence the name venereal disease. Albert Neisser, who was a venereologist, mainly was known for his discovery of the bacteria that caused the disease, which is a bacteria called Gonoxus, I think is how you say it. He discovered that in 1879. Another interesting fact that I thought was cool was that, well, not cool, but interesting, was that in the 1970s, there were nearly around 1 million cases reported per year of gonorrhea. And clearly that's gone down a lot today. Today we have about 300,000 cases per year reported due to the increased use of condoms. As we said before, women are 80% asymptomatic, meaning they don't show symptoms. And then this is our works cited page.